My name's Marie Kilpatrick. I have been at Monash Health for 11 years now, since I emigrated to Australia. I've always worked within the Monash Children's team. I used to work at Monash Children's at home, and in the last 18 months I was successful in gaining my nurse manager's position in 4A Canopy, which is the paediatric medical oncology ward. I don't ever remember my first conscious thought of wanting to be a nurse, but my mum always told me from I was a very small age, even before I started school, I talked about being a nurse, but always wanted to be a paediatric nurse, not just a nurse. I wanted to do paediatrics. My sister is a nurse, and I was very clear that I wanted to do paediatrics, and so that was the journey I took, and was very clear that was where I wanted to go. It's 25 years this year since I started my training to become a nurse, so I've been out and about for 25 years. To me, exceptional patient experience is that the patient and the family, because we're always dealing with the families, no matter whether it's in paediatrics or in adults, there's always extended family. They need to feel safe, reassured and confident in everything that the nursing staff and the medical staff are doing for them. And they need to trust everything that we do and that we're doing things for them for the right reasons. To me, exceeding expectations is important because it's always important to challenge ourselves and to challenge the standard of care that we give. And if we continuously try to improve that, then we're constantly raising the bar of what normal expectations are, and therefore we set ourselves apart when we improve and improve and improve and go above what patients expect. My style is I'm ever present. I'm always on the ward. I'm around for staff to be helpful, to ask questions, to do whatever. But I also am very clear on my expectations of my own standards, and I'm very clear with them what my expectations are of their standards. And obviously it's always being open and saying, you know, if someone isn't meeting where you would expect them to be, having those conversations, whether it's easy or difficult to do it, you have to speak to someone and challenge them and say, you know, this is what I expect. But I'm also someone that's always prepared to just get in and help. So if something needs done, I'm happy to be there and happy to help the staff and support with whatever aspect of care that it is. The patient I never forget that I'd like to talk about is a patient that I cared for whilst being here in Australia, and I've looked after her and her family while in the community setting, but I was also visited them multiple times at home, did some teaching with the family, transitioned them from hospital care to being at home. But through her life, she deteriorated, and through end-of-life care, I worked at Very Special Kids when I was part-time, and I was lucky enough to be at Very Special Kids at the end of her journey and at the end of her life. So I was able to be there and support and care for her family there as well. So for me, that was quite a privileged and special position to be in, because I knew them at home, and I also knew them through this very difficult time in their life as well.